2 weeks after we began our special reports, the U.S. Surgeon General issues an advisory about healthcare burnout with an edict to urgently address the problem. Tonight, those on the front line share their concerns about policies, practices, and the impact on patients.
Our first date was not really a date. October 10th, 1980. I mentioned going to see Bruce Springsteen, and Rhonda said, gee, that sounds like fun, maybe I'll come with.
So we went to see Bruce. That was fun.
And we still like him.
We met as doctors. We've been doctors together for 42 years.
Ed Smolovitz. I'm a retired internal medicine physician. Okay. Today's the end of 40+ years of being a doctor. Looks great. I'm ready. I guess I should leave. I have a large geriatric practice. I think studies show that about half of all doctors are burned out. On the spectrum of really burnout to not burnout, I would put myself less than average, but somewhat burned out.
Bye. Thank you.
I feel relieved that I can leave this behind.
Keep moving, enjoy the music. The music is really what Zumba is all about. So let's have some fun. You know, my practice was difficult and things were stressful. You can't think about anything else when you're doing Zumba. My name is Rhonda Stein. I am a recently retired geriatric physician. So
June 24th of 83.
Yeah.
It's a story about me and my wife talking about our experience as residents and going into practice.
I went to work at a neighborhood clinic right after a residency, so I did that. I worked at 43rd and King Drive for 2 years. I am surprised at how little I miss work. I mean, the meat and potatoes of what we do is sitting down and having the one-to-one relationship with the patients. And what is most frustrating, I think, for both of us about the work is how much of it ends up not being that.
Okay. My name's Perinda, and I'll be taking care of you. Okay. I always had that motherly instinct to me. Even if I'm having a bad day, I have a smile on my face. So I wanted to share that with everybody. So like with this IV, we're gonna be sure it stops bleeding before you go. I've been a nurse for 3.5 years, almost. Today I have just 3 patients. Normally it could range anywhere from 4 or 5 or 6 even sometimes. Some common side effects that happen with the Norco, you can get upset stomach. You don't want to take it on empty stomach. During the height of the pandemic, I was working overnight shifts.
Was there ever a moment in that time that you thought to yourself, oh my, this is way more than I thought it was going to be?
Definitely. I think one day I specifically can remember there was another nurse. She'd actually asked for help with turning her patient in bed. Sometimes you need 2 people to do that. So I'd gone in to help her, and after we put on all of our gowns, our masks, and all that good stuff, and we went in there, the patient actually wasn't alive. And whenever they had passed, knowing they were alone, whether they knew what was going on or what had happened to them, not having anybody by their side, I think it just hit me the hardest then that did I really sign up for this? Like, that is gonna stay with me throughout wherever I go in my nursing journey.
There's a lot of pessimism right now. A lot of people that are saying the system is broken. What do you say?
I agree. I mean, there's definitely things we're doing right, but in its entirety, I do believe that the system is broken. Keeping people healthy should be what we're focused on, not just treating them when they get sick, putting patients first and realizing that health of an individual is also the health of a nation.
What would you say is the worst thing about medicine right now?
The inability to get the things that you need to take optimal care of your patients. You watch commercials on television for these wonderful drugs, and ask your doctor if so-and-so is right for you. Well, first you have to ask your doctor if your insurance company is going to allow you to have it. That's a big barrier. I think the healthcare system in America is so badly broken. I should be sitting there thinking about what do I need to do to make this diagnosis, not how much of a pain is it going to be for me to have to deal with authorizing this through an insurance company before I ordered this test. Is it worth that? That should not factor into my decision about what kind of diagnostic workup to do on a patient. Am I going to have to argue with somebody about this?
We often talk about working at the top of your license. And that would mean that the doctor does things that only he or she can do. Probably 30% of what I did was at the top of my license, and the other 70% I did because I could have used more support, or the support had gone home for the day and I wanted to get it done. And so if I saw my last patient at 5, I could easily be there till 8 or 9 finishing paperwork.
You look ahead, say another 5 years from now, do you see things getting better or worse?
I worry about the cost of care, the complexity, the ability for people to afford their insurance and to get the care that they need. Many internists, when you go to book an appointment, could be 3 or 4 months down the road.
I don't miss the day-to-day headaches. I do miss and will continue to miss many of my patients and the people that I work with and the camaraderie in the office. I will miss that. I miss it now.
Can you see yourself in this role 30 years from now with the same amount of energy and optimism?
I definitely think so. I really do. When people ask me, oh, do you like nursing? Even with the pandemic, do you really like it? And I always tell them I love it. I wouldn't imagine myself doing anything else.
With optimism and skepticism, some carry on while others walk away. But they all agree the conversation is critical to effect some much-needed change. Back to you.
Two perspectives.